अभी मैंने आपको एक सीक्रेट बताया था कि वो पकड़ लिए हैं आप लोग, तो आई ट्राई टू शो यू वेयर एग्जैक्टली दैट पॉइंट्स आर लोकेटेड। आपको देखो, मैंने ये पूरे हेड को हाँ, हम लोग रिकॉर्डिंग भेज देते हैं मैडम, कभी मौका मिलता है तो देख लेना, वरना अगर कोई डाउट होता है तो अभी मैं खत्म करता हूँ, उसके बाद आप पूछ लेना, मैं क्लैरिटी कर देता हूँ। अभी ये होने के बाद अभी मैंने जो बताया था सीक्रेट, आप प्लीज आप इसको ध्यान से सुनिएगा, देन यू अप्लाई अकॉर्डिंगली, दिस विल गोइंग टू वर्क फॉर यू। ये कहा कि आपका जो अपर पार्ट, मैंने हेड को डिवाइडेड इनटू 3 में डिवाइड करता हूँ। अभी पूरा सर और नेक को हम लोग 3 में डिवाइड कर रहे हैं। ये कहा कि आपका जो टॉप ऑफ द हेड, वन इज द टॉप ऑफ द हेड, ये पूरा जो हिस्सा है स्कॉल्प, सो दिस इज द टॉप ऑफ द हेड। द सेकेंड उसका लोअर पोर्शन होता है ग्लैबेला रीजन, जो फोर ब्राइन और यहाँ पे जो नेक नहीं, क्या बोलते हैं इसको, या फोरहेड रीजन है, उसको हम लोग सेकेंड लेवल मानते हैं। देन आईज एंड देन ईयर, थर्ड लेवल। देन इसको मैंने चिन, बिलो द नोज, चिन को उसको फोर्थ लेवल, और आके थायराइड को फिफ्थ लेवल। तो इस तरीके से हम डिवाइड करेंगे। तो अब मैंने 3 सोचा था, मैंने आपको 5-6 तक बता देता हूं। दिस द फर्स्ट लेवल, this is the first level of the head. The second level of the head to be known as a forehead, right? Then the third level is eyes, ears, nose, right? Then the fourth level is the lips and then chin. Then the fifth level is thyroid, right? Thyroid cartilage, and then pharynx and larynx. So this much I'll try to cover now to treat how can be treatable by using the some of the dermatomes, right? So you just आप थोड़ा नीचे कर लो, थोड़ा स्प्रेड डालो इसमें, ठीक है। अभी हाउ टू लोकेट, प्रॉपरली फोकस करो, हाउ टू लोकेट दिस पॉइंट, यू ट्राई टू फाइंड आउट दिस द C7। C7 को कैसा फाइंड आउट करेंगे, जब आपका वेटेब्रास रोटेट नहीं होता है, दैट टू बी नोन एज ए 7 सर्वाइकल वेटेब्रा। ये पूरा रोटेट हो रहा है आपको, ये रोटेट नहीं हो रहा है, isn't it? ये रोटेट नहीं हो रहा है। So this to be known as a C7 vertebra. From the C7 vertebra, 3 chun above, 3 chun above, तो फिर यहां पे अगर जाते हैं तो फिर हमें मिल जाएगा तो सर्वाइकल वेटेब्रास, द अटलास और एक्सिस। सो ये जो पोस्टीरियर हेयरलाइन है, पोस्टीरियर हेयरलाइन, so that region to be known as a, that just proximal to that region, यानी half chun proximal to that region of the hairline और half chun lateral to the, half chun lateral to the midline। याद रखिए, समझ से आपको करना है। ये पोस्टीरियर हेयरलाइन है, पोस्टीरियर हेयरलाइन से आधा इंच यानी 1 सेंटीमीटर अबव, देन हाफ सेंटीमीटर, दैट मीन्स 1 सेंटीमीटर lateral, 1 centimeter lateral, then it is the 1 centimeter above, that means it's the half inch above, right? Now you can see here, this called as a C1, C1, then just below to that is the C2, below to that is the C3. Now C1, I just apply here half chun needle, C1 vertebra I just applied, that's called as a atlas, half chun lateral to the atlas. So atlas bone if you applied bilaterally, then you are treating to the top of the head region. अगर ऊपर के सर में दर्द हो रहा है, the upper topmost border which we call as a crown chakra having the problem, sahasrara having the problem, or this entire the parietal region, this region called as a parietal region having the problem, then the parietal bone can be treatable by activating the which vertebra here, C1 vertebra or the C1 area to be selected over this region. Now there is the problem is on the temporal region having the problem. Temporal region, and also there is a forehead region having the problem. So that particular time we just apply. So this is 1 point here, this on the C2 vertebra, half chone lateral to the vertebra. This we can use it as a second vertebra, cervical vertebra, to treat for the temporal region, to treat for the temporal headache, and also migraine related conditions can be successfully treatable by activating this point. And then the forebrain, that means especially the frontal head, frontal sinusitis, frontal headache in the glabella region can be treatable by using this point. Now the problem is in the ears, the problem is in the eyes, the problem is in the nose, in the sense organ having the problem. So that time you just activate this point, that is on the C3 point, you just use it. Now the ears and then all the sense organ can be connected over this region, right? Now there is a problem is on the chin region, or the tooth related problem that need to be activated. You can use the point, either you can use the unilateral or the bilateral. Better if the paralysis, hemiplegia is there, you can use the opposite side. For example, the problem is the hemiplegia happen on the left side, then you need not to apply the needle on the left side. Better you apply on the right side, because the right side is affected. Like that you just apply this region. Then further you wanted to apply the for the thyroid related problem, then you can cover this region, that's called as a cervical 5. You can use it the cervical 5 for the thyroid related problem. From here you just select thyroid and then parathyroid condition, thymus gland related conditions. Certainly successfully you can use by using this specific points. Either you can use unilaterally or the bilaterally. I have shown you both the sides. Better if there is a thyroid is there, you just use, because thyroid, parathyroid, both the sides are existing. That's the reason apply the bilaterally is advisable. In this way we can cover for the head and neck related disorders successfully can be treatable. But here you are giving the signal to the brain. There again you wanted to use the local point, you wanted to use DO20, you just use it. Again you wanted to use the hypothalamus, use the gallbladder, that means is a Sanjo 20 Geosan point. Whether you wanted to treat for the thalamus, you use the Hanyan, that is the gallbladder 4 point, you just treat. When you wanted to use the epithalamus, subthalamus, hypothalamus, that can be treatable on the gallbladder 7 point, you can use it. In that way we can integratedly activate. You are giving the signal from the cranial nerves, and also you are giving the signal to the local command point to treat for the scalp related disorders. So thank you. I just wind up now.